Hello, my name is Catherine.
My name is Cynthia.
My name is William.
Hi, my name is Robert.
And today we are presenting our study, Leveraging Machine Learning Methods to Predict COVID-19 Vulnerability in U.S. Counties based on Socioeconomic Factors. So first of all, coronavirus is a new disease that first appeared in Wuhan, China on December 31st, 2019. And as of July 1st, 2020, in the U.S. alone, there are over 2 million confirmed cases and over 127,000 deaths. Of course, not all areas in the U.S. were affected equally, and our study aims to predict which areas are more vulnerable than others. So our main objective is to use machine learning algorithms to construct a model that can predict a county's COVID-19 vulnerability from pre-pandemic socioeconomic data. Through this model, we hope to both identify counties that are at risk and understand which socioeconomic factors affect pandemic spread.
As far as work published in other studies, the main focuses have been on, first, models for identifying risk factors for COVID-19, second, projecting the trajectory of cases going forwards, and third, predicting U.S. individuals and counties most vulnerable to COVID-19. To expand upon and to kind of tie together ideas from these previous studies, our study 1 investigates a much wider variety of factors, 2 takes a more complex approach by defining custom time sensitivity measures, 3 uses county-level data rather than state or national-level data to account for local nuances, and lastly focuses on machine learning classifiers rather than regression models.
Now we will move into a brief overview of our methods. First, we sourced the dataset and then we defined custom measures to quantify vulnerability. Then the data was pre-processed and multiple machine learning classification algorithms were used to create our predictive models. From these models, lists of the most important socioeconomic features were extracted. There were two main components to our data, socioeconomic data and COVID-19 time series data. Starting with the first component, county-level socioeconomic data was sourced from databases including but not limited to the U.S. Census Bureau and the Association of American Medical Colleges. Then 103 data fields for 2,610 U.S. counties were used as features in classification. These features included economic indicators, medical personnel and infrastructure, population demographics, crime statistics, and population health statistics. The second component to our data was time series COVID-19 data. This data was sourced from the New York Times, and it included the cumulative numbers of cases and deaths in each county beginning from January 1st, 2020 until June 27th, 2020.
Classifying vulnerability. In the absence of a well-defined measure of vulnerability, we have taken a multifaceted approach by considering vulnerability from three different perspectives: incidence, mortality, and case fatality. To better fit our study, we modified the formal definitions of these three terms with the formulas presented on screen. To account for different counties getting their first case at a different time, we consider the cases and deaths within a 30-day time period starting on the day with the first confirmed case for each county individually. For data pre-processing, we prepared a second data set that is PCA transformed and whitened, as some classifier benefits from this type of data pre-processing. To evaluate our classifiers, classification was done on each vulnerability measure with and without PCA. We evaluated classifier accuracy for each classifier listed on screen with threefold cross-validation after some parameter optimization. For feature importance, the importance of each feature was assessed for each of the vulnerability measures without PCA using the getF-score function located in the XGBoost package.
So now we're going to move on to our results. First, we have histograms to visualize the distribution of all the computed county scores. On the left is incidence, in the middle is mortality, and on the right is case fatality. For each histogram, there's a total of 2,610 counties represented. We can see that the scores associated with death in their computation, so mortality and case fatality, have a lot of small values. This is good news because it indicates a very small proportion of individuals are dying due to COVID-19 in the majority of counties.
So now we will present our classifier results for each definition of vulnerability. First, we have our incidence results, where our best achieved predictive score was 43.3% using the XGBoost classifier without PCA. On the right, we have a confusion matrix, which summarizes the predicted categories versus their true categories. For example, we can see there are 96 incidents where we predicted a county to be part of the -7 category, but its true category was -6. Lastly, the average prediction accuracy for incidence across all classifiers was 35.5%. On the next slide, we have two graphs plotted with latitude and longitude to depict their locations in the United States. The graph on the left represents the true categories of these counties, and the graph on the right represents the predicted categories. For example, we can see the true values of the two counties in Hawaii were -8 and -9, but both were predicted to be a -8.
COVID-19 mortality was predicted most successfully using a random forest classification algorithm with no PCA. This had an accuracy of 57.1%. The average predictive accuracy of all tested classifiers was 52.0%. Now, looking at the confusion matrix on the right, we can see that a majority of counties were predicted to have low mortality at a category of -14. On the diagonal, we can see all of the accurate predictions. Now, we can see two scatter plots with all counties plotted based on their latitude and longitude. On the left are the true values of each county's mortality, and on the right are the predicted values. This once again reiterates that a majority of counties were predicted to have low mortality at a category of -14. However, many were also predicted to have a category of -11.
In predicting case fatality, we achieved the highest accuracy of 60.5% with the XGBoost classifier. The average accuracy across all classifiers was 56.1%. The confusion matrix on screen shows exactly where the mistakes were made. In this scatter plot, we can again see true categories on the left and classifier predictions on the right by color. This also shows exactly which mistakes were made and where.
After seeing the results of our classification, particularly the success of XGBoost, we were curious about which features were most responsible for the performance. Here, using the getFscore function built into the XGBoost package, we determined the top 10 important features for each target. To summarize the table, the top features were generally related to population change, location, income, education, pre-existing health statistics, and the number of medical practitioners. Now we're going to move into the discussion and analyze our results in greater depth. One of the main results that we generated was the performance of various classification algorithms on our dataset. Essentially, we were predicting COVID-19 vulnerability based on socioeconomic factors. As we can see in the summary table below, depending on the target, our best accuracy ranged from about 43% to about 60%. The performance of the XGBoost classifier on a case fatality had an accuracy of 60.5% and seems to support the conclusion that socioeconomic features may at least partially predict case fatality. Just as a reminder, case fatality is defined as the total number of deaths over the total number of cases. This intuitively makes sense because a county's ability to take care of its sick directly influences the outcome of many of its cases. On the other hand, the shortcomings of these results, or why they aren't a higher percentage, also seem to speak towards the role of non-socioeconomic features. These might include public sentiment, or local, state, or even national policies, as well as the public's compliance to these policies.
From the average predictive accuracy for incidence, mortality, and case fatality, it is clear that mortality and case fatality outperform incidence consistently. We hypothesize this is due to the fact that the number of cases may be less accurately reported than the number of deaths. It is likely that counties without exhaustive testing may have inaccurate confirmed case counts due to the asymptomatic nature of COVID-19. Since the feature list from the XGBoost classifier does not report the exact correlation, we cannot speculate about specific relationships between these features and vulnerability. Nonetheless, we found our results to be interesting because both typical and atypical pandemic-associated features appear in the list. Hopefully, in the future, the unexpected features such as education can be further investigated, but our study provides a solid starting point for which socioeconomic factors may reflect pandemic spread.
Now we will discuss improvements and avenues for future study. In future iterations of this study, it will be important to collect more data relevant to the spread of COVID-19. For example, data pertaining to recent local air travel patterns or the frequency of superspreader events such as rallies and concerts. In addition, the optimization of classifiers has the potential to yield much higher predictive accuracies, seeing that we only adjusted a few parameters for each classifier. In the future, it will also be important to adopt more nuanced and refined vulnerability scales that may take into account other factors such as the acceleration of infection rates. In addition, the lower predictive capabilities of these classifiers may be attributed to a poor spread of data across the different classes. For example, due to the skewed distribution of COVID-19 incidence across the US, few counties have scores that fall in the extremes of the incidence scales. These score distributions lead to classifier bias, favoring the median values and neglecting the extreme values. In future iterations of this study, a uniformly distributed scale should be used to train classifiers to attempt more accurate, less biased predictions. Finally, perhaps the most pertinent avenues of future study lie in the feature importance lists. The features on this list can serve as the basis of future regression studies, which may explore the degree to which these features associate with the COVID-19 vulnerability.
As the coronavirus continues to impact the world, the need for novel predicting methods to get one step ahead of the disease has never been higher. This study has established the groundwork for a powerful predictive tool for public health use to identify at-risk communities, both for this pandemic and future pandemics. In our model success, we have identified important socioeconomic factors, namely factors related to education that have been previously overlooked when modeling pandemic. In its shortcomings, we have reaffirmed that the state and the public's action during a pandemic is just as, if not more important than pre-pandemic readiness of a community.